North West Tonight can reveal that last year, in Greater Manchester alone, £30 million was spent on people who turned up to A&E and didn't need to be there. Now those in charge of healthcare in the region say radical changes are needed to stop the waste.
Well, a group of GPs in Salford say that they have slashed emergency visits by making themselves available on the phone day and night. Many, though, believe attitudes to A&E need to change before there's a real emergency in emergency care. Well, our health correspondent Nina Warhurst has been looking at this story in more detail. She's here now. Nina.
Thank you, Roger. Yes, there's not a doctor in the country who'll tell you that there's no need to visit an A&E if there's a genuine emergency, but increasingly we're using it as our first port of call. NHS Greater Manchester estimates the average cost of an A&E visit is £170 and that 44,000 more people turned up for emergency care last year than the year before. Now, they think that around 30% of them didn't need to be there, and that meant that £30 million was spent that didn't need to be. Patients' reasons are varied from I couldn't get in to see my GP to I tried NHS 111 but they couldn't help. Now, Healthier Together, who are reorganising care across Greater Manchester, say reducing A&E admissions has to be made a priority. And a group of GPs in Salford think they may have found at least part of the solution. And it's remarkably simple.
Good morning, hello, it's Dr. Totty from the Gambia practice. What can I do for you today?
Dr. Totty calls it a telephone triage. Patients phone in, discuss what's wrong, and he decides whether it's A&E, GP, walk-in or pharmacy care that's needed.
And 40% of the people that actually ring don't actually want an appointment that day, they just want some advice, and I can do that safely on the phone, freeing up the appointments for the people who really need it, especially the illest people as well, who need to be seen usually within a couple of hours.
In just 3 months, there's been a 15% drop in patients who have access to the phone system appearing at A&E. Why? Well, the poorliest are getting to see their GP straight away, and the rest, like Angela, feel reassured that there's always a doctor on the end of the phone.
I think we really value and appreciate the fact that you can pick up the phone, have that conversation before you even get here. It might be that you can then go to work for the day if you're well enough.
What do you do with those? Does they ever bump up against the target?
Last week, the Prime Minister was at Salford Royal, announcing an injection of £500 million into emergency care. But this is about much more than money.
Patients need to be more responsible about how they use and access the health service, and in return I think it's reasonable for primary care and in particular GPs to be more flexible with the hours that they can offer patients.
So give her the paracetamol now, then recheck her temperature in about an hour's time.
This Salford clinic's encouraging other surgeries to follow because we don't have a bigger budget, but we are living longer, getting sicker, and as ever, expecting more from the NHS. So the overall message is that the situation we're in now is not sustainable. Yes, we're all entitled to feel that the NHS is there for us when we need it, but we're also responsible for thinking about where we go for our care.
Nina, thank you very much indeed. Nina Warhurst.
Well, we asked for your comments about problems getting a GP appointment, whether you've had to go to A&E instead. Huge response on this today. Lots have been in touch by email, Facebook and Twitter. Do you want to kick it?
Yeah, Gemma Marshall emailed to say that she'd called her doctor and explained that she's off work for 3 weeks, so she could go in any time. They said they couldn't fit her in and to call early every Monday for an emergency appointment. Gemma goes on, if I don't see a doctor in the next 3 weeks, I may have no choice but to go to A&E.
Dale Ellershaw said when his back went into spasm, someone went to the local surgery across the road, but they were told to call an ambulance and go 15 miles to the nearest hospital. He says, when I got to A&E, they couldn't believe I'd been sent there. All I needed was painkillers.
But Gary Phillips is one of several people with a positive story. His doctor's is in Blackpool on Facebook. He said, it's a great service. If you phone before 9, you can usually get an appointment the same day, if not the following day. I've never had to wait more than until the next day. Thank you for all the correspondence that we had on email, Facebook and Twitter on the story. Yeah, sorry we didn't get to read all of them out.